rheumatology is a very vast topic, and homeopathy is better therapeutics in chronic disease. I don't know you people are from which strata in terms of whether you people have the people who are managing hospitals or are having private practice or are still postgraduate students only or no. So if you feel there is any problems in between, you can always ask me questions. I have tried to fuse modern medicine thoughts with basic homeopathic perspective in trying to be more clinically oriented, alright? Because in rheumatology, clinical orientation is of extreme importance. Basically, all sciences are based on observation, right? That's how science comes. And medicine is fantastically into observation. And Hahnemann brought out this whole concept purely out of the art of observation. So, if we observe properly the clinical picture, which is so important in rheumatology, then we have done a lot towards diagnosis, towards therapeutics, and towards therapeutic posology. So if you don't keep a discipline in getting to the clinical picture, the whole picture, clinical picture. I'm repeatedly underlying that clinical component. If we don't keep that discipline while taking the history into reaching the destination of the correct diagnosis and thereby the correct therapeutic posology, we could be in a tangle. Absolutely. Alright? And we'll see how it comes. Why we have to be so important about the observation, the clinical observations. All these guys ahead of us have talked about observation, alright? And Hahnemann more so with, I think I'll need the pointer. I have the pointer in this. I'm sorry. उसको बुला सकते हैं? Multi-system involved rheumatological disorders. We do find, apart from the clinical thing, homeopathically also it makes a huge sense in observing them in the minutest details in terms of their, say in every individual case of the disease, knowledge of disease. Now if the aphorism 3 is so explicit in this, how can we miss the clinical picture? Our books have mentioned this. Only thing, over a period of time we have lost out on it, or we have got too bored to do all that. So, when we say that we want a diagnosis in rheumatology, we are not away from the tenets of homeopathy. There are a lot of people who say, what the hell, how does it matter? You don't need to get the diagnosis. If you have got the state, if you have got the drug, that is good enough. But no, then you have missed the totality. Because if you are talking of totality, then diagnosis is a huge part of that totality. Because a patient who may be a polyarticular rheumatoid is one totality versus someone who has a pain from last 20 years but is only fibromyalgia or the stress related soft tissue pain. Both are presenting with 20 years of pain, both are presenting with joint pains, but the diagnosis makes a huge difference in the totality. And if you have not considered that pathology, you have not considered the depth of the disease, you have not got to the totality. So why is the diagnosis not so important? It is absolutely important. And that is what the clinical picture, when we say, we are talking in that totality terms, that we say that we need to get that clinical totality there. Because unless you have known what is the depth of the problem, unless we have known what is the exact diagnosis, and which means unless we have known what exactly is the functional disability and the disease state, we cannot achieve our therapeutic objective. Because we need to know, okay, this is the depth till which we need to, I wouldn't say the word cure, but I need to train the force in such a fashion that it can bring back some amount of health. Because most of the rheumatological conditions, as we go further, by the definition of the word cure, are not so. We cannot cure them, we can only control them. I know I am making a very major statement and it can raise a lot of eyebrows, but we will prove that as time comes. So, I am still underlying the same thing. we need to be very attentive to the clinical picture and come to a diagnosis. Because even in modern medicine today, though we feel that modern medicine has now become too specific, it has become too intrusive, but it's still, rheumatology is a branch where it still keeps its holisticness, the truly holistic thing. Whereas homeopathy, if it is holistic itself, how can it lose on that totality of diagnosis? What normally we see is only the tip of the iceberg. The patient has come to you with a joint deformity, or the patient has come to you with pain. Actually, deep down, there is so many other things which have happened before that guy has presented you as that. The concept of disease in modern medicine and the concept of disease in homeopathy, though looks extremely different, but this is kind of triangles that tells us about the same thing. Like homeopathically, we talk about that in health there is good amount of coordination between man and the environment. However, there will be fundamental miasms and basic constitutional which can't be changed. On that, if there is stress, then that particular system is under stress, but there will be no complaints. Then you will start getting higher characteristics, some associated symptoms, maybe some constitutional symptoms. That goes further deeper. See, we are talking about from health towards disease, alright. We start getting the functional and the mild damages with the characteristics still on. Then we start getting the severe and the more deeper damages where the characteristics go away, and then you ultimately have multi-system irreversible damage. What does modern medicine say? Same thing. Health is components of heredity, environment, and there is some unknown stimulus which stimulates the immunopathological forces to go towards up, which then causes states of emotions, which then causes autoimmune states, which then causes antigen allergy reactions, which then causes inflammation, then causes a chain reaction and hence damage and disability. It's the same thing. We just need to open our eyes to that. And if we have not understood what this is, we need to actually understand this. That's what I meant by tip of iceberg. You are seeing only this. Baki ka 1/8 is down, and that's where your whole jagda is. That's where your whole battle is. Sometimes, if we go into too many small details, we can miss the whole. Like, detailed picture, itna sab dikh raha hai, but actually, if you are to see it from a distance, it's actually a glacier with so many other details which you would have missed. This is just a case. I'm trying to tell you that in rheumatology, you cannot afford to be on either one end. You have to have that balanced approach. Or sometimes everything looks similar, you know, pain, getting up after rest. So Rustock's picture sub rheumatological disorders mein baithega. So everything looks similar, but if you go into the details, they are different. Okay, because RA will be different, SSE will be different, SNE will be different. Sometimes same way. It looks, everything looks, but they are different. And how are they different? Let's find out. Because this I am obviously not the right person to talk of, but please read this, because if we go into the smaller details, we shouldn't miss the larger picture, but at the same time, we have to get the smaller details to get the larger picture. So, you have this whole spectrum in rheumatological disorders, where to start with you can have only functional problems, to